Hi everybody, my name is Dr. Khandaker Talha. Welcome you all in the CSL class of Junior Surgical Posting Year 3. Today we are going to discuss about venipuncture. In this video, there are two parts. In the first part, you will watch one PowerPoint presentation, and second part is the video clipping parts. There are two video clippings. In the first video clipping, you will watch venipuncture on a patient, and in the second video clip, you will watch auscultation venipuncture on a mannequin. Hope you'll enjoy the video. Okay, let's watch it out.
Today we're going to be performing phlebotomy with a straight needle on a live patient. The most important part of any procedure is making sure that you have the appropriate equipment before you begin. So today we have gathered our equipment and set it out. We will use non-sterile gloves. We will use a tourniquet to apply to the patient's arm in order to engorge the vein. We will use a 2x2 piece of gauze. We'll use an alcohol swab to cleanse the area. We will be drawing a CBC, which in this case is a lavender vacutainer. We'll be using a plastic hub to attach to our venipuncture needle. So, we also are going to be using Coban today instead of a Band-Aid because our patient has sensitive skin and Band-Aids sometimes irritate people's skin, so Coban is another option. So I'm going to wash my hands as I would before any procedure. Then I'm going to don my gloves. I am actually going to connect the needle to the hub before we begin. You can see this attaches right here. It screws in. And be careful because this is rubber on the outside, but underneath is a sharp needle that actually pokes right into the vacutainer and breaks the seal on this. So be careful because if you push hard enough on this, you can hurt yourself, stick yourself. So we're going to attach that, and then our needle is underneath here, so when we're ready to perform the procedure, we'll just remove this. I usually like to kind of put the vacutainer gently inside here for now. Just got everything ready. And I'm going to open up my alcohol swab here, set that aside, and now I think we're ready for our patient. So we will have our patient place the arm on the sterile area here, and we'll explain the procedure to the patient. Today we're going to be performing phlebotomy. Have you ever had phlebotomy before?
Yes.
Okay, do you know of any good veins?
Yes.
Where are they? Are they in your antecubital area here?
Yes.
Okay, so I'm going to apply my tourniquet, and I want to make sure that I can get it off quickly. So what I'm going to do, instead of tying a knot, I'm going to cross it and just tuck a little corner underneath so that when I'm done I can pull this off very quickly. Okay, so now I'm going to have my patient make a fist with his hand so I can kind of see which veins are going to be good. It's very important to palpate. Alright, I think we're going to try this one right here. Okay, I'm going to cleanse the area. You can see I'm cleansing in a circular fashion. We'll let that dry. Sometimes the alcohol can sting a little bit if you poke the patient while it's still wet. Okay, going to remove my cap from the needle. I'm going to pull traction, and we're going to begin the procedure. So you're going to feel a poke, okay?
Mm-hmm.
Okay. With straight needle, you don't get a flashback, so you just have to assume that you're in. And we are. So you can see the blood automatically begins filling this. We want to fill about 3/4 of a tube to the entire tube. If we had additional vacutainer tubes, we could pop them on. However, we do not, so I'm going to remove the tourniquet now. I'm going to pop my vacutainer off, invert the tube, and pull the needle out while applying pressure to stop the bleeding. This is a retraction needle, so what we can do is clamp this. So now we'll place this in the sharps. And I'm going to get my Coban ready, so I'm going to ask the patient to gently hold pressure for just a second. Okay, got a pre-cut piece here, so you can let go. Thank you very much. And I'm going to wrap this around. So Coban, if you've never used it before, it's kind of like an ace wrap, but it's a little bit sticky, so it sticks to itself without having to use any additional metal pieces or anything like that. Alright, So once you're done with the procedure, again, you want to invert your tube, label the blood, send it to the laboratory, and always clean up your area. We'll thank the patient.
Hi, my name's Adam. I'm a fourth year medical student. Could I check your name, please? And what's your date of birth? Great. What I've been asked to do today is to come and take some blood from you. That'll involve putting a small needle into one of your veins and it'll feel like a sharp scratch. Would that be okay? Great. Ideally, you'll have an apron on for this procedure. Okay, I'm now going to put a tourniquet on. Tell me if it feels too tight. Does that feel okay? Good. Apply the tourniquet to help you feel in the patient's veins. When looking for a vein, it's better to have one that you can feel rather than see. Look for the direction of the vein. And once you've found a suitable one that seems straight and big enough to go into, get the rest of your equipment ready. Put some non-sterile gloves on. Use an alcohol swab to clean the area that you're going to take the blood from. Clean it in a circular motion for about 30 seconds. I'm now going to prepare the needle. And screw it into the barrel. I'm now going to insert the needle into the vein. Is that okay? It should feel like a sharp scratch. So first take the sheath off the needle. Make sure the bevel's pointing upwards. Secure the vein that you want to take the blood from and insert the needle at 20 to 40 degrees in the direction of the vein. You should feel a slight give as it goes into the vein. Then secure the barrel to the skin so that you're not moving it as you put the vacutainer on. Fill as many vacutainers as you need to with blood. Again, fixing the barrel to the skin each time you remove or replace the vacutainer. Before you take the needle out, remove the tourniquet. Get some cotton wool. Cover the site of the needle injection. Remove the needle, only putting pressure on once the needle's out. Then get the patient to hold the cotton wool or gauze in place for a minute after you've taken the needle out to catch any bleeding. Thanks for letting me take your blood. To complete the procedure, I'd fill out the patient details on the vacutainer bottle and make sure the blood sample is sent off to the labs for testing.